So the CDC has lost roughly a third of its workforce in 8 months. Is this reform or retribution that put our public health and federal merit rules at risk? The New York Times had a great article yesterday, so I wanted to focus on the CDC within this one. So let's break it down. I'm Sean with Southworth, PC, a law firm that represents federal employees nationwide. Here's what we're seeing and why it matters to every federal employee. Reporting indicates that HHS leadership dismissed CDC's vaccines advisors, pushed out top officials, and fired a Senate-confirmed CDC director who refused to sign off on an anti-vaccine agenda. Mass RIFs and rescissions have ping-ponged throughout the agency, with hundreds of terminations reversed after sloppy implementation. On paper, the administration says this is an efficiency play, moving work into a newly Administration for a Healthy America, shrinking CDC to communicable disease response. In practice, funding and lines of authority are murky, state partners weren't meaningfully consulted, and functions like injury prevention and surveillance are left dangling. When a reorg structure is unclear and the execution is chaotic, courts, unions, and oversight bodies start asking whether this is reform or humiliation, or I think medical malpractice, not literally or legally, but metaphorically. So here's the law in plain English. If you truly reorganize, you still have to follow Title V and OPM's RIF rules, competitive areas and levels, retention registers, veterans preference, and bump and retreat rights. Employees are entitled to a specific written RIF notice, normally 60 days before the effective date, and this notice must include the reason, the effective date, your retention standing, and appeal rights. If an agency discovers errors midstream, it owes amended notices, not rumored fix-ups. And if a RIF is used as a pretext to target employees or programs for reasons unrelated to legitimate reorganization, say punishing scientific viewpoints or manufactured non-essential labels, that's squarely in prohibited personnel practice territory. Political retaliation and whistleblower reprisal are illegal under 5 U.S.C. 2302, OSC, and MSPB have jurisdiction. Your deadlines are real, though. Contact an EEO counselor within 45 days for discrimination claims. File MSPB appeals of RIF actions within 30 days of the effective date of the RIF or receipt of the decision, whichever is later. So what does this mean for you? I treat every notice and heads up like evidence. Get your status and competitive vary in writing. Ask for your retention register info if your unit gets cut today and uncut tomorrow. Demand amended written notices that comply with 5 CFR Part 351. If you're told your work is moving, insist on the transfer function analysis rather than a paper separation. The agency invokes a 30-day window, ask for OPM approval letter. Then protect your timelines, EEO in 45, MSPB in 30. Again, talk to your union and consider speaking with legal counsel before proceeding. So what do you all think of what's happened this year to CDC, HHS, and the federal government in general? Do you feel that this is good political leadership or is this chaos? What impacts does this leadership have? Is it, in the case of CDC, weakening our public health system or helping it? And I guess more broadly, HHS too. We'll let you know if we can help you if you reach out. So feel free to reach out to see if we can help you pressure test the agency's actions, protect your rights, represent you. And also, regardless of that, I appreciate a lot of your support and people following us. If you don't want to miss any update from us, rely on the algorithm to send it to you. Feel free to get on our free daily newsletter at fedlegalhelp.com/newsletter. Thank you, everybody, for your support. Have a great day and take care.